The ambient sound. Hello there.
Hi.
You're looking very colorful today.
Thank you. We got a little Jasper competition down here just in case.
Oh, who is it?
Krishna.
Krishi. There is no competition. Sorry.
He thinks there is.
The only competition is in Krishna's head. Nothing more. All right. So you and I have been talking about doing this for a while, and today is the day we're gonna find out and talk about the advantages of getting mercury removed from your mouth. So I've never asked you this question. How many, do you know, rough estimate, how many holistic biological dentists there are in this country that do what you do?
Probably not that many. There's more now than there has been, because I do certification for safe mercury removal with the International Academy of Biological Dentistry and Medicine, and we have a lot of new dentists doing it now. But when I started out 25 years ago, there were hardly any.
So let's talk a little bit about your background. You went into dentistry as a straight dentist, and then you had your eyes opened around two things. One, the fluoridation of the water, which we're not probably going to get into today, but and congruent with that, though, was mercury and the dangers of mercury. Do you want to talk about how that happened and how you got your eyes open to this?
It started, there was a ophthalmologist actually in town who was doing chelation therapy. Mm-hmm. And he took me to lunch one time because he needed a dentist to safely remove the fillings out of the patients, because otherwise you're just going up the down escalator. Every time you chew or swallow and you have mercury fillings, you're getting more mercury into your body because the heat, even drinking coffee makes them emit vapors, and then it goes into the rest of your body. So he wanted someone to safely remove it, and sat down and had a nice lunch with me. He actually gave me a huge poster of all the teeth relations to all the different body parts and organs. I still have it in the office framed. It's great.
So I've never asked you this question before. It's kind of funny that you're a guest now. So how long into your practice did this occur? How long have you been practicing dentistry, and all of a sudden you get your eyes open?
12 years, probably about 12 years.
So you practiced dentistry straight for 12 years. Mm-hmm. And then you have this epiphany and this revelation. You're like, wow, this thing is related to a lot of health issues, and I have to re-rack and rebrand and redevelop who I am and what I do.
Mm-hmm. I also checked my levels, and my levels were off the chart of mercury toxicity at the time, and started working on that.
Right. And
then I started seeing patients get better after they get removed and they would detox.
And this is another question I never asked you. How long did it take you to get up to speed from being a traditional dentist to being a biological dentist and being able to do what you do now?
It started slowly. I guess that the staff was getting upset because every time I'd go to a conference, they go, oh no, we're changing this. I think the last thing on board was the root canal issue. I started doing the mercury removal and doing it safely. And then, of course, the fluoride. It took all the fluoride out of the office. And then the last thing was the root canal.
So we'll go back to mercury. We'll return in a retrograde fashion to mercury. Let's talk about the root canal thing. Tell people about why root canals can be really dangerous.
So all your teeth go to different organs energetically, kind of like your foot. Like if you have you can see the different organs where they represent on the foot or the ear or the palm. Well, all the teeth go to different organs or body parts too. So it's threefold. Number one, you can have an energetic blockage on that area from the root canal because it's dead. Dentistry is the only profession that leaves something dead in your mouth. If your appendix is dead, they take it out. Your toe's dead, they cut it off. So the tooth is made primarily of these dentinal tubules, these tiny little tubes that are stacked one on top of another. So if you stretch them out, a molar has 3 miles of those tubules in the tooth.
That's amazing.
So in the middle of the tooth is the nerve and the blood supply. So when the tooth dies, the nerve actually dies. So when they do a root canal, they actually pull out that nerve and the blood supply and they fill it with this rubber stuff, and then you have your tooth, but it's sitting there dead. But when the tooth's alive, the nerve is flushing those tubules clean all the time. When you pull the nerve out, nothing's flushing those tubules, so all the bacteria go into those tubules and they hide, and the body can't get to them. So they sit there and they morph and they emit toxins, and just it's like a little condo for bacteria. So but your body can't get to it anymore because you've taken the blood supply away. But every time you chew or you put pressure on it, it spills out into your body, into your bloodstream, and it can go onto weak organs or, cause trouble in your body with the toxins. They have shown that the root canals will emit a toxin that actually kills the gene that kills cancer cells in your body. So
Really?
That's an issue if someone has cancer. And thirdly, your spleen, knows that there's something dead there. So it's going to be sending extra white blood cells there all the time. And it uses them up where they could be used somewhere else where you need them. So It's kind of a waste of your white blood cells.
In terms of percentage of people that have mercury in their teeth, I would say probably the majority of the population has this, right?
It depends. It depends how cavity prone you were or how long ago you had them put in. Mm-hmm. Still probably half the dentists still use it because it's cheap and easy, which is sad. And the problem is getting them removed. You want them removed safely, or you're going to get more exposure.
So you sent me an image, a couple of images here. And this is what it looks like when you go in and remove mercury. There's a high degree of containment, right? So I'm assuming this is you and one of your assistants, and you guys are wearing your COVID masks there, and you're completely hazmated up. And this is what's going on with the patient. And there's this very large evacuation tube, which goes to a significant filter, right? Like you can't just have this stuff go out into the environment anywhere.
No, I actually have a filter on top of the ceiling that vents outside. And I also have, the suction has a mercury trap that catches the mercury so it doesn't go into the sewer system also.
So there's a lot that actually goes into this, not just from your place as a practitioner, but also the environmental stuff, because people, I'm sure, would ask the question, well, if this is so bad for me, then what's going to happen when it gets out of me, and where's it going to go? So where does it go once and I've never asked you this question either. Like where does all the trapped and old mercury go to?
Well, we have a mercury trap that's on the end of our suction. Mm-hmm. That's supposed to trap it, and then we have to clean that. We have to send that in and replace it every once in a while. We have the patient actually rinses with charcoal beforehand. We give them charcoal. I mean, there should be another picture of the tooth totally isolated. We isolate the tooth so that nothing leaks through. Yep. And so that we're getting rid of most of the vapor, because once you hit it with the drill, it vaporizes and it's way more toxic.
Right. You sent me a video, which is too long to play on this show. It's about a smoking tooth.
There should be another picture with that one right before.
Yeah, so I'll put the link to the smoking tooth, and I think this is the picture that you're referring to, which is right here. But the video is an interesting one, and people, it's about a 20-minute video. So I would recommend people understand like how serious this is by taking a look at that video. So here you go. This is the picture you were telling me about.
Yeah, she had 3 fillings there, and we totally isolate them so that nothing leaches through.
Right.
When we're drilling. And that's like a mercury cream that helps absorb the mercury as well.
Right.
And a nitrile dam, because you don't want latex. It goes through latex.
Oh, really? Wow. Mm-hmm. So this is another question I've never asked you, but when did the practice of filling teeth with mercury start?
Actually, it's an interesting story. So I think around 1850s, there was a group of dentists who they used to just fill with gold. If they came up with this mercury concoction. So the mercury fillings are half mercury and half different, like 5 or 6 different metals powdered. Mm-hmm. And you mix it together, and you have a certain amount of time before that sets up and gets hard. So you can just pack it in there and smooth it off, and then you're done, right? Mm-hmm. So they came up with this this concoction, and the dental association at the time said, "Are you kidding? That's mercury. You shouldn't put that near the brain. It's not good." And they said, "Well, we'll just start our own dental association." And that's how the American Dental Association started. They actually have the patent on the amalgam fillings.
So that was they started around this whole thing with mercury. That's how they began.
Yes.
So they needed basically like a lobby and to support their practice of filling mouths with mercury. Wow, interesting.
That's why they still say that the American Dental Association will still say that it's okay. But we have to treat it as a hazardous material before you put it in the mouth and after you take it out of the mouth. But somehow, miraculously, it's not hazardous in the mouth.
Right. So once it's in your mouth, it's all good.
Yeah.
It's all safe inside your mouth. Otherwise, it's going to kill people or do damage to them.
Yeah.
Wow. Okay. So what are the benefits of not having mercury in your mouth?
Well, mercury causes two problems in the mouth. You have this galvanic problem, the current that it emits. So I actually have a little meter. If someone wants their mercury fillings removed, we check the charges of each tooth. So most of the teeth will have a charge. And then the saliva in your mouth acts like the water in a battery, and you get this buzz going on, which can cause brain fog, jaw pain, different things. So we actually will check the charges of each filling and then remove the highest ones first, because you want to ease your brain and your body out of that and keep yourself in parasympathetic so you don't have a crisis. So that's an issue. If you get your fillings removed immediately and you have a result, it's usually from that galvanic issue. I had someone, we do all the removal, but then we take all those things that we're wearing and the garb and the rubber dam, and I bag it up and I take it outside. And as I was coming back after the patient's getting rinsed with charcoal and everything, she goes, "Oh my God, I can see again. I can see again."
Wow.
And she had a filling right here by her eye, when that was the galvanic thing, because it was immediate. Right. The mercury toxicity itself, you have to detox. So, but that's mercury's is a neurotoxin. So any mood swings, depression, irritability, tremors, neurologic problems, any of those diseases with neurological problems. Also, it's inflammatory. So every time you swallow it, you're inflaming your gut. All disease starts with inflammation. So.
Right. So it sounds like it's a two-step process. The first process is get the mercury out and try to have some level of homeostasis with that. But then you have to detox after that because of the effects of the mercury.
Mercury has a 40-year half-life, so it doesn't come out in your lifetime.
Wow.
So you have to kind of coax it out or pull it out or make sure that your detox pathways are working. You can do herbal stuff. You can do the heavy-duty chelation areas. I mean, if you're going to detox, you don't want to make sure your body's moving, your bowels are going, because you don't want to loosen it up and then reabsorb it again.
So a lot of people will use from the natural world cilantro as a metal detox, and then there's EDTA, which is also used for detoxing. And I think I've heard that zeolite actually works as well.
Zeolite. A note with the cilantro: if you still have mercury fillings in your mouth, don't eat cilantro, because it's going to loosen it up and it's going to go right to your brain when you're chewing. Same with chewing gum. So don't chew gum if you have mercury fillings in your mouth. So
this is another question for you. When you do remove the mercury, let's say you get it all out, and then you do the detox, you also have to make sure that the metals or the trace minerals that are good for you are still getting in your body.
Exactly.
So what do you suggest for people, or how do they go about doing this? Like being involved in the removal process, but not leaching their body of all these other things that are important.
I would make sure you're having a vitamin C, so everything's flowing and going. Fulvic acid is really good. You can actually detox with the fulvic acid, but that's a good source of minerals. Glutathione, your liver naturally makes glutathione. Glutathione is a great detoxer, or NAC. You can do NAC as well. You can do the cilantro, the spirulina. That doctor that first got me into this, he would have his patients make a pesto cilantro and eat it every day.
Right. But then you have to bring other minerals and back into your body at the same time, right?
Yeah, the fulvic acid is
fulvic acid. Yeah, fulvic acid will do that.
And selenium. You want to make sure you have enough selenium because that helps you detox.
So you've been doing this for a while now, which means that you've had the ability to track your patients over time. What have been some of the long-term results from patients that you've done this for? Can you like pinpoint that and maybe tell a story or two about that?
I just had a young patient who was going off to art school, and he had this huge filling, a huge mercury filling on his upper right. I think he had forever, and it was breaking down, and he actually needed a crown. And he had several others on the other side. So we started with that one. And when he came back to do the other side, he had had eczema for a dozen years he couldn't get rid of. He said the next day it started going away, which I was surprised because he still had mercury in his mouth. But
it might have been enough to tip the scale a little bit. Did you finally pull out the rest of that mercury?
Yeah, we did. And then he was really doing well. I've seen a lot of acne and gut issues, a lot of gut issues. And a lot of brain fog and memory issues and, anxiety, irritability.
Right. Now, true confession here. I had a filling that cracked, and then it was connected to the filling that was with mercury. So you actually took the mercury out of my mouth about, 3 weeks ago or 4 weeks ago, something like that? And it wasn't that big of a deal. I mean, I had some help with the nitrous oxide, some of Chris's CBD, but it wasn't that big of a deal. So if people are freaked out about it, and it looks super intense with all the gloves and all the protection, it's not that bad. I mean, I can tell you it's not that bad, but you only want to do like one at a time. How many teeth have you done? The most teeth have you done at one time for mercury removal?
Usually I don't cross the midline. So you don't want to cross the midline. That's Huggins protocol. And I usually do the highest charge quadrant. I usually do a quadrant at a time. So meridian wise, one side will compensate for the other. So you don't want to hit both sides of the meridians at the same time because it'll weaken you a little bit.
Right. So if you have, say, 2 on one side, you could do 2 on one side. Is that right?
Yeah, depending on the charges and how healthy you are.
Okay.
And or if you have them in a row, like the person we just showed the picture, she had 3 in a row, so we did hers.
All 3 at the same time?
Yeah, they were all.
So when you say healthy, how do you determine the health of the patient? Like, can you look at somebody and go, okay, this patient only gets 1 removed today or 2? How do you do that? How do you go about determining their health?
Well, some of them will come in with issues. I get a lot of patients with health issues or autoimmune issues or cancer. I mean,
right, but in that moment, like you make a judgment call and you say, okay, I could go all 3 in this person. Right?
Well, I usually do it by quadrant, and it depends if I want to do upper and lower or not, depending on how they are.
Yeah.
If the charges coincide with it.
Right. At one point, I think there was somebody else that was doing what you were doing in Austin, maybe 2 other people, if I'm right. But I think you're the only dentist now in Austin that is doing this. Is that correct?
No, I think there's several others. Some of them a couple of them have sold their practice. So I'm sure hopefully they have people doing it too.
Right. Well, one of the things that I've noticed is that you will get people from all over the country coming to have this done at your place, which is pretty significant. And I think maybe they'll like to come to Austin and have a mercury removal vacation.
That's fun.
but it's a very specialized practice, and one that I think is pretty worthwhile. The other thing that's interesting is, like, in this world that we navigate in, it's amazing how many people have had or are in the process of having their mercury removed. So it seems to be a particular mindset where people are more involved with their health at kind of a, autonomous or sovereign level. Can you talk about the idea of having this done and the individual having a sense of empowerment and being really engaged on managing their own body and their own health?
Well, at least your mouth is something you can control. There's so much other toxins out there in the air, in the, everything else we're bombarded with. At least you have some control over what's in your body, what's in your mouth. So that's a big help. And the bad thing is when it is in your mouth, you're constantly getting exposed to it, constantly.
Because it's one of those things where I think it's a really sneaky form of empowerment. Like, okay, I'm going to get to the root of some of my issues that, might be related to this mercury that's in my mouth. We're going to get it done, and we're going to see what happens, but I'm taking charge of this, right? I'm taking a step in my life to make my life better, which I think is really a good thing. And, when you were able to work with a practitioner like yourself who understands this, and it's more of a symbiotic relationship, I think it's one of these things, because people always ask, well, what can I do? What can we do to change our lives? Well, here's something that you can do that really impacts you on a physical level, medical level, and by making this choice from a place of volition and will. What do you think about that?
Yeah, and actually, it actually will affect if you're trying to get pregnant. I mean, it does cause infertility, and you don't want to have any mercury going to the baby, because that really causes problems the smaller they are.
Yeah, and that's a whole other issue too, huh?
And they say the best way to detox a mother is to have her breastfeed. So guess where the mercury goes? It goes in the breast milk.
Interesting.
Which is not good. So I get a lot of women before they want to get pregnant.
Well, you could always get formula if that's the case, right? Oops.
Oh.
Do that. Okay. Well, Dr. Joan, this has been very informative. Thank you for being here.
Thank you.
And I'll leave a link in the show notes here at the bottom. If you're interested in taking a mercury removal vacation to Austin, you'll be able to hook that up. And if you have any questions about having mercury removed from your mouth, I'm sure Joan will be able to answer them for you. So thanks for being here.
All right. Thank you.
I'll see you later.
All right.
Okay. Bye.
Bye.